Did you know that millions of people have diabetes and don't even know it? That's right, this chronic condition often develops gradually, and many people might dismiss the early warning signs as just part of life's daily stresses. But ignoring these signs can have serious consequences. Recognizing the early signs can make a huge difference in managing the condition. Early diagnosis allows for timely intervention, helping prevent or delay the onset of complications. Today, we'll be discussing 10 common early warning signs of diabetes that you should never ignore. Remember, I'm not trying to make you anxious, but to empower you to take control of your health. If you notice any of these signs, it's essential to consult your doctor for proper diagnosis and treatment. Let's talk about frequent urination, especially at night. We all get up to pee once in a while, right? But if you're making more trips than usual, or waking up multiple times, it could be a sign of diabetes. High blood sugar makes your body get rid of excess sugar through your kidneys. When there's too much sugar, it spills into your urine. This pulls more water, leading to increased urine production. If you notice a sudden increase, get checked by your doctor. Early detection is key. Now let's talk about that excessive thirst I just mentioned. Feeling unusually thirsty all the time? Like you can't seem to quench your thirst no matter how much water you drink? This could be another early sign of diabetes. Remember how we talked about frequent urination being a way for your body to get rid of excess sugar? Well, all that peeing also leads to dehydration, which triggers your thirst mechanism. Your body is smart, and it knows it needs to replenish those fluids. So if you're constantly reaching for your water bottle, or you wake up multiple times during the night feeling parched, pay attention. It could be your body's way of signaling that something's off with your blood sugar levels. Of course, thirst can be caused by other factors too, like hot weather, strenuous exercise, or even certain medications. But if you're experiencing excessive thirst along with frequent urination, especially if it's a new symptom, it's crucial to talk to your doctor. Let's move on to our next sign, extreme hunger. We all get hungry, but if you find yourself constantly feeling ravenous, even after eating a meal, it could be a sign that your body isn't using insulin properly. Insulin is like a key that unlocks your cells and allows glucose, the sugar from your food, to enter and provide energy. But in diabetes, your body either doesn't produce enough insulin or can't use it effectively. This means that even though you're eating, your cells aren't getting the glucose they need for energy, leading to a constant state of hunger. You might find yourself feeling hungry again soon after a meal, or experiencing intense cravings, especially for sugary foods. Now, it's important to remember that everyone experiences hunger differently, and feeling hungry sometimes is perfectly normal. But if you're noticing a sudden or dramatic increase in your appetite, or if you're feeling hungry even after eating more than usual, it's worth discussing with your doctor. Next up, we have unexplained weight loss. Now, I know many people might think, what's wrong with losing a few pounds? And while it's true that losing weight can be a positive thing if you're overweight or obese, losing weight without trying, especially if it's significant or rapid, can be a warning sign of diabetes. Here's why. When your body can't use glucose for energy efficiently because of insulin problems, it starts looking for alternative fuel sources. And guess what it turns to? That's right, your body starts breaking down stored fat and even muscle for energy. This process can lead to weight loss, even if you haven't made any changes to your diet or exercise routine. So if you're noticing that your clothes are fitting looser, or you're seeing a drop on the scale without any explanation, don't just ignore it. It's important to get to the root of the issue and rule out any underlying medical conditions like diabetes. Early detection and treatment can help prevent further weight loss and other complications. Let's talk about fatigue. We all feel tired sometimes, right? But if you're experiencing persistent fatigue, that feeling of being constantly drained and lacking energy, even after getting enough sleep, it could be a sign of diabetes. Remember how glucose is the primary source of energy for our cells? Well, when your body can't use glucose effectively due to insulin problems, your cells are essentially starved for energy. This can lead to feelings of fatigue and weakness. You might find it difficult to get through the day, needing frequent naps or feeling like you're dragging yourself around. Now, fatigue is a very common symptom and can be caused by a variety of factors, like stress, poor sleep, or even certain medical conditions. But if you're experiencing persistent, unexplained fatigue, especially if it's accompanied by other symptoms like increased thirst, frequent urination, or unexplained weight loss, it's essential to talk to your doctor. Now let's talk about blurred vision. Our eyesight is precious, and any changes should never be ignored. Blurry vision, especially sudden or fluctuating, could indicate high blood sugar. High blood sugar can damage the tiny blood vessels in your eyes. This damage can cause swelling in the lens, leading to blurred vision. Early stages might be temporary and improve with stable blood sugar. Untreated, it can lead to serious problems like diabetic retinopathy. Don't wait. Schedule an appointment with your eye doctor right away. Let's talk about slow-healing sores. Our bodies have an amazing ability to heal themselves, but high blood sugar can interfere with this natural healing process. If you're noticing that cuts, scrapes, or sores are taking longer to heal than usual, it could be a sign of diabetes. High blood sugar can damage blood vessels and nerves, which are essential for delivering oxygen and nutrients to tissues, including those involved in wound healing. When blood flow is impaired, it slows down the healing process and increases the risk of infection. So if you get a minor cut or scrape and it seems to be lingering for weeks without much improvement, or if you notice any signs of infection like redness, swelling, warmth, or pus, it's important to see your doctor. They can assess the wound, determine if there are any underlying factors affecting healing, and recommend appropriate treatment. Let's talk about frequent infections. Our immune system is our body's natural defense against harmful bacteria, viruses, and other invaders, but high blood sugar can weaken our immune system, making us more susceptible to infections. When your blood sugar is high, it creates a favorable environment for bacteria and fungi to thrive. Additionally, high blood sugar can impair the function of white blood cells, which are the soldiers of your immune system responsible for fighting off infections. If you're experiencing frequent or recurring infections, especially in certain areas like your skin, gums, urinary tract, or vaginal area, it could be a sign that your blood sugar levels are not in check. Now, everyone gets infections from time to time, but if you're noticing an increase in the frequency or severity of infections, or if you're experiencing infections that are slow to heal or unusual for you, it's essential to talk to your doctor. Let's talk about tingling or numbness in your hands or feet. This pins and needles sensation, often described as neuropathy, can be an early sign of nerve damage, and unfortunately, high blood sugar is a major culprit when it comes to nerve damage. Over time, high blood sugar can damage the small blood vessels that supply nerves with oxygen and nutrients. This damage, known as diabetic neuropathy, often affects the nerves in the extremities first, particularly the feet and legs. So, if you're experiencing tingling, numbness, burning, or pain in your hands or feet, don't ignore it. It's important to see your doctor to determine the underlying cause and receive appropriate treatment. Early detection and management of neuropathy are crucial to prevent further nerve damage and preserve sensation. Remember, taking care of your feet is especially important if you have diabetes. Inspect your feet regularly for any cuts, sores, or changes in sensation. Finally, let's talk about darkened skin areas. You might notice patches of darker skin, often velvety in texture, appearing on certain areas of your body like the back of your neck, armpits, groin, or elbows. This skin condition, known as acanthosis nigricans, can be a sign of insulin resistance. Insulin resistance is a condition where your cells don't respond properly to insulin, the hormone that regulates blood sugar levels. This resistance can lead to a buildup of insulin in your blood, which can stimulate the overproduction of skin cells, resulting in those darkened, thickened patches of skin. While acanthosis nigricans itself is harmless, it's often a visible sign of an underlying issue, like insulin resistance, which is a major risk factor for type 2 diabetes. So if you notice any unusual darkening or thickening of your skin, especially in those typical areas, it's important to bring it to your doctor's attention. They can assess your overall health, check your blood sugar levels, and determine if further evaluation or treatment is needed. So there you have it, 10 early signs of diabetes that you should never ignore. Remember, knowledge is power, and recognizing these signs early on can make a world of difference in managing your health. If you notice any of these signs, don't ignore them. Consult your healthcare provider for a proper diagnosis and take control of your health today. Early detection and treatment are crucial for preventing complications and living a long, healthy life. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Don't forget to subscribe to my channel for more informative videos on health and wellness. Until next time, stay healthy.